I want to talk to you about a subject that's just taking hold in both the orthopedic and the scientific community. Many of you may know, because of your study of failed hip implants, that there's been a progression over time of hip implants failing due to metallosis, or tissue damage caused by metal being given off from implants. The history of that's basically as follows. It starts with the DePuy ASR. We're talking about a bearing surface failure. There were other implants that were similar, but it would be a construct that looks like this with a metal head and a one-piece metal cup that articulate like that. And there were all kinds of theories about what was wrong with the recalled DePuy ASR, but essentially this metal interface on this metal cup caused excessive metal debris to be cast into the patient's hip, and ultimately it failed and had to be removed and revised. Sort of the next generation of the discovery of failed metal implants would be with the Rejuvenate and ABG2 Stryker products. The innovation there was that they took a one-piece metal stem and they basically made it into two pieces. The neck and the stem. The stem is implanted in the femur. The neck then is impacted into the stem. Well, this wasn't such a good idea either. Both the Stryker Rejuvenate and the ABG2 bimodular construct was recalled from the market in 2012, essentially because they figured that this interface between the neck and the stem, neck being made of chromium cobalt, stem being made of titanium, when that was impacted in there, you would have motion, micro motion at the interface, which would disrupt the surface of the metal, and then you would have intrusion of biologic contaminant into the interface. And the combination of the motion and the biologic material led to corrosion products and, again, metal debris being distributed into the tissues around the hip. Where we're headed now into the next generation of orthopedic and scientific study about failures of metal implants for metal-related issues, or metallosis, or tissue damage due to metal contaminant in the tissue, is scientists and orthopedic surgeons are now very, very, very concerned that this interface, this being the trunnion of the stem, inside a metal head, you can actually get corrosion and motion at this interface. Typically, in this construct here, you have a titanium stem and a chrome cobalt head. Remember I told you that the Rejuvenate recall was motivated because of a chrome cobalt neck in a titanium stem. Dissimilar metals at a metal on metal junction. So it's actually identical, almost an identical failure mode in these constructs where you have a titanium interface connecting to a chrome cobalt head. Now, many people who have implants in their body have a ceramic head on that titanium stem. It is widely believed that that is a safe construct. However, the scientific community is starting to discover that when you put a metal head on a metal stem, you can have an identical failure, at least by result, to the DePuy ASR, the Biomed M2A Magnum, the Wright Medical Conserve, and then in the second generation of bimodular hips, like Stryker, with the Stryker Rejuvenate and ABG2. What's the problem with that? Well, the biggest problem with that right now is the information about these trunnion failure cases is not widely disseminated yet. No product to date has been recalled because of the metal-on-metal interface between a titanium head and a chrome cobalt neck. So the information in the orthopedic community is scant, and the information that the patients have is scant. So what is the result of that? The result of that is there are people out there right now who have an extremely painful hip. They've had it for a year, 2 years, 3 years, sometimes 4 years, and they continue to go to their doctor and complain of the hip. Many doctors will tell the patient, well, you know, that's not a recall product. I've done an x-ray of the hip looks like it's in perfect alignment, it hasn't come loose, the stem hasn't subsided. It must be your back, and they send them to the back doctor. Or it must be your knee, and they send them to the knee doctor. And they go to the back of the knee doctor and they say, no, your back's fine, your knee's fine. And so they come back to the orthopedic surgeon and they say, my hip still hurts like heck. Then the doctor might give them some steroid injections, or they may aspirate the hip, or they may consider infection as a possible cause of your pain and your disability. Truth be told, for a lot of patients, none of those things are what's going on. The device isn't loose, it hasn't moved, you don't have an infection. What you really have is you have corrosion going on at the interface between the head and your stem. And we have some pictures of some explants of people that have been revised, appropriately diagnosed and revised for this. And as you can see on screen right now, here is a picture of a trunnion during a revision surgery, and you can see quite clearly that there is black corrosion products on the trunnion. Where does this leave us and you if you're interested enough to be watching this? For those people that have extremely painful hips and have been going to your doctor for some time without an answer about what's going on, it might be prudent for you to get your product ID stickers and see, are you one of those people that has a titanium stem and a metal head? Just metal head, chrome cobalt head, titanium stem. And if you do, and you don't have an answer for why you are so painful, and you've been appropriately worked up to rule out infection, loosening, subsidence of your hip, then you probably should demand that your doctor do a blood, chromium, and cobalt study on you to see if the ions in your blood are elevated. If they are, then you should probably demand that a Mars reduction technique MRI scan be done on your hip to evaluate the soft tissues around this construct to see if there's evidence of fluid collection or pseudotumor formation. If after both of those studies your ions are elevated, either chromium or cobalt, and you have an MRI scan that is concerning for tissue involvement, I would suggest that you seriously consider discussing revision of that hip, because it's not going to get better, it's just going to get worse.